Hello friends, so this is our first educational video, and in this video we will be talking about the muscles of the upper limbs. So if you like this video, please do subscribe to the channel and do hit the like button. So the very first topic that comes when we speak of this very thing is the muscle of pectoral girdles, and the muscle of pectoral girdle starts from the supraspinatus muscle. Now, the supraspinatus muscle originates from the supraspinous fossa and has its insertion in the greater tubercle of the humerus. Now, the action that it performs is initiation of the abduction of the arm. I hope you know what abduction is by now, and the nerve supply is the suprascapular nerve. The next muscle is the infraspinatus muscle. The infraspinatus muscle originates from the infraspinous fossa, which is located over here on the scapula, and has its insertion in the back of the greater tubercle of the humerus. It helps in lateral rotation of the arm, and the nerve supply is the suprascapular nerve. Now the next muscle is the subcapularis muscle. It originates from the subcapular fossa, which is located over here. Unfortunately, the diagram is not complete, so I can't show it to you, and has its insertion in the lesser tubercle of the humerus, which is located over here. So the nerve supply is the subscapular nerve. The next one is the teres major muscle, which is located over here as you can see, and has its origination from the lower angle of the scapula, which will be located over here if the diagram would have been complete, and has its insertion in the medial lip of the intertubercle sulcus, which is located somewhat over here. So the nerve supply is the lower scapular nerve, and the action that it performs is abduction and medial rotation of the arm. So the very next muscle that is located below it is the teres minor muscle, which has its origination from the lateral border of the scapula and has its insertion in the humerus below the infraspinatus, which will be somewhat over here. So the nerve supply is the auxiliary nerve, which is same as the deltoid muscle and has the action of laterally rotating the arm. So the next muscle is one of the most important muscle and is the deltoid muscle, which is located on the superior surface of the shoulder or the pectoral girdle. Now it has three originations. The first one being the lateral third of the clavicle, the acromion, and the spine of the scapula. The insertion is the deltoid tuberosity of the humerus, and the action is abduction of the arm. So the nerve supply is the auxiliary nerve, which is same as teres minor. Now the very next muscle after the muscles of pectoral girdle is the muscles of arm. It starts with biceps brachii. It has two parts, a short head and a long head, which is clearly shown over here in the diagram. So the short head originates from the coronoid process and has its insertion in the distal part of the radial tuberosity, which is somewhat over here. So the long arm has its origination from the supraglenoid tubercle, which is located somewhat over here and has its insertion in the proximal part of the radial tuberosity. Now they both perform the same action, which is they help in flexion, and the nerve that passes through them is the musculocutaneous nerve. The next one is the brachialis muscle, which originates from the front of the lower part of the humerus and has its insertion in the tuberosity of the ulna, which is over here, and performs the action of flexion of the elbow. And the nerve that passes through it is the musculocutaneous nerve and the radial nerve. Now the next muscle is very important and is called the Coricobrachialis muscle. Now it originates from the coracoid process along with the short arm of the bicep, which is over here, and they both originate from here. So and it inserts in the medial side of the humerus, which is over here. The action that it performs, it moves the arm upwards and medially. The nerve is similar to the biceps, which is the musculocutaneous nerve. Now the next muscle is the triceps brachii. It has three parts, the long head, the medial head and a lateral head, which is not shown in this diagram. So the long head originates from the infraglenoid tubercle. The lateral head originates above the spine line of the humerus, and the medial one originates from the back of the lower part of the humerus. As we can see over here, the long one is located over here. This one is the long one which runs over here. The medial one is over here, and unfortunately the lateral one is not represented in this diagram. Now there's another muscle which is not shown over here, which is known as the Anconeus, or muscula Anconeus in Latin. It originates from the lateral epicondyle of the humerus and has its insertion in the proximal one-fourth of the posterior surface of ulna. The action is extensor of the elbow and the nerve is the radial nerve. Now, these muscles are divided up into two parts: the posterior group, which consists of the anconeus and the triceps branchii, whereas the remaining muscles fall under the category of the anterior group. Now, the next group of muscles are the muscles of forearm. It is divided up into two parts again: the anterior group and the posterior group. The anterior group has four muscles, namely the pronator teres muscle. Now, the pronator teres muscle has its origination from the medial epicondyle of the humerus. Now, the nerve is the medial nerve. The thing to be noted over here that the origination of this muscle, the medial epicondyle of humerus, is also known as the common flexure origin, because all these muscles help in flexion. The next muscle is the carpi radialis muscle. Now this muscle originates from the common flexor origin, as we all know, and has its insertion in the base of the metacarpal 2 and 3, which are over here. The action that it performs is flexion and abduction of the wrist, and the nerve that passes through it is the median nerve. Now, the next muscle, which is located over here, is the palmaris longus muscle. Now, the palmaris longus muscle originates as from the common flexor origin, but has its insertion in the flexor reticulum and the palmar aponeurosis. Now, we are going to study about palmar aponeurosis ahead in this video, but the action that it performs is the flexion of the wrist. Muscles often absent in it, so the nerve that passes through it is again the median nerve. Now, the fourth muscle that passes through it is the flexor carpi ulnaris muscle, and it originates from the common flexor origin, but with this, it also originates from the outside border of the ulna. The insertion is to pisiform and PC-metacarpal ligament to the fifth metacarpal. The action that it performs is the flexion and abduction of the wrist, and the nerve that passes through it, thing to be noted, is the ulnar nerve. All the other muscles had median nerve passing through it, but this one has the ulnar nerve. Now, the posterior group has five muscles, the first one being the brachioradialis. Now, the brachioradialis originates from the lateral subcondylar ridge of the humerus, which is located in the lower part of the humerus, and has its insertion to the base of the second and the third metacarpal. The action is extension and abduction of the wrist, and the nerve that passes through it is the radial nerve. Now the next muscle, or I must say the next muscle, are the extensor carpi radialis longus muscle and extensor carpi radialis brevis muscle. They both originate from the lateral supracondylar ridge, and they both have their insertion on the base of the second and the third metacarpal. The action is the extension and abduction of the wrist, and the nerve is the radial nerve. The next muscle in the posterior group is the extensor digitorum, which has its origination as the common extensor origin, and also the lateral epicondyle of the humerus. The insertion is in the base of the middle and distal phalange of the two fingers via the extensor expansions. So the action that it performs is extension of the fingers and wrist. Now the next muscle is the extensor digiti minimi. Now it originates from the common extensor origin, as we all know, and has its insertion is the extensor expansion of the little finger. The nerve that passes through it is the radial nerve, and the action is extension of the little finger. The next one being the extensor carpi ulnaris. The origination is the common extensor origin and the posterior border of the ulna, because as we come to know by its name itself, it has ulna in its name. So it has its origination from the posterior border of the ulna and has its insertion in the base of the fifth metacarpal. The action that it performs is extension and abduction of the wrist, and the nerve that passes through it is the radial nerve. Now further, the anterior and the posterior groups are divided up into two parts, the superficial layer and the deep layer. Now the anterior deep layer has four muscles, namely the flexor digitorum superficialis. Now it originates from the common flexor origin and has its insertion in the side of the middle phalange of the four fingers. The action that it performs is flexion of the proximal two phalanges of the wrist, and the nerve that passes through it is the medial nerve. Now the next muscle is the Flexor Digitorum Profundus. So it originates from the front of the shaft of the ulna and its posterior border. It has its insertion in the distal phalanges of the forefinger. The action that it performs is flexion of the fingers of the wrist, and the nerve is the half medial nerve and half ulnar nerve. Now, the next muscle is the pronator quadratus muscle, which originates from the lower end of the front of the radius and has its insertion in the lower end of the ulna. The action that it performs is pronator of the forearm, and the nerve that passes through it is the median nerve. Now the next muscle is the flexure Polycis longus. It originates from the front of the shaft of the radius, has its insertion in the distal phalanx of the thumb, and performs the action of flexion of all joints of the thumb. The nerve that passes through it is the median nerve. Now there are five muscles of the posterior deep layer as well. The first one being the extensor Polycis longus. The origination of this muscle is from the back of the ulna, and the insertion of this muscle is on the base of the distal phalanx of the thumb. The action that it performs is extension of the joints of the thumb, and the nerve is the radial nerve. The next muscle is the extensor Polycis brevis. It originates from the back of the radius, has its insertion in the base of the proximal phalanx of the thumb, and has the action of extension of the proximal phalanx of the thumb. The nerve that passes through it is the radial nerve. The next muscle is the abductor pollicis longus. The origination of this muscle is the posterior surface of the radius and ulna and has its insertion on the base of the first metacarpal. The action that it performs is abduction and extension of the thumb, and the nerve that passes through it is the radial nerve. The last muscle which is depicted on this picture is extensor indicis. The origination is from the back of the ulna, similar to other muscles as well in the group, like this one. The insertion is to the side of the extensor digitorum tendon, and the action that it performs is extends the index finger, and the nerve that passes through it is the radial nerve. Another important muscle which is not shown in the diagram is the supinator muscle. It originates from the lateral side of the humerus and ulna. Insertion is that it wraps around the radius to be inserted into the upper part of the shaft. The action that it performs is supination, and the nerve is the radial nerve. Now the action is quite similar to the name. So these were the most important muscles. Now there are various other muscles which are located in this. Remembering all the muscles is not possible. So this was just how the important muscles of the hand or the arm work, and what is their origination, what is their insertion, and what is their nerve, and what is their action. So if you like this video, I'll be bringing another part of this video in which I will be talking about the topography, the facies, and the muscles of the wrist. So please do like this video, do subscribe, and tell me how this video was. Thank you so much for supporting. Guys, we have reached 45 subscribers with just 4 or 5 videos, and hopefully we will be reaching 100 subscribers by the end of this month. So please do subscribe and please support me with this whatever I am doing, and hopefully we will be a big family soon. Please do like this video and please do comment if I can bring up any other topic and discuss that over here, because I am also a student and discussing all these topics strengthen my core as well. So thank you so much for watching this video.